Hello everyone, I am recording this video in response to the survey that we sent out last month and the questions that were asked specifically from the parents so that we can sort of touch on the things that are in the forefront of all of your minds and give us a little bit of a focus for what this video can be about this time around. So we're definitely going to keep updating our families as the summer goes on. We are currently open right now, and so we were able to get a lot of things set in place for our program to reopen May 1st. Granted, we are going to have a lot more classes, a lot more families, and a lot more students on campus in September, so there are still a lot of things that we are working on to make sure that we have the safest environment for your children and for your families. So just to get started, I wanted to kind of explain that we are considered a child care program. So if you're doing any of your own research and are sort of looking up what the health department guidelines are or what licensing may require, it'll be a little bit different than if you're looking up guidelines for reopening schools. So public schools and private schools are under a different set of guidelines than preschools because we are under Title 22, which is the community care and licensing guidelines, as well as we just work with a much younger group of children than other schools do. So just to put that out there, the child care is what we are working under. And if you are the type of person that just likes to do your own research, then that's what you could look into to sort of see what they're recommending for us to do. So to get started, one of the main questions was what our COVID-19 emergency response plan would be. And I think that's a great question, of course. So we did have to create that when we reopened in May, and licensing and the health department already approved our emergency response plan, which basically is very straightforward. So if we do get a positive test result from either a student or a parent or someone living within the household of the student and the parent, or a teacher, or someone living within their household, then we will immediately notify all families with as much information as possible. We do have to keep the individual name confidential, but we'll give as much information as possible so that you yourself can also make a decision of whether you want to drop your child off or pick them up from school immediately. And then directly after that, we notify licensing in the health department. So what the most important thing is that the health department will help us to decide our best plan of action, but it's really case by case. So it really just depends on the specifics of each case, and they help us work out if we need to close or what we need to do, anything differently. They go over our cleaning policies and everything. And we did have one experience over the summer so far where a parent did test positive. She notified us immediately. The child was kept home until test results came back, and once they came back, we sort of followed our plan of action that we were going to notify the families and so forth. So we ask that each of you just remember what your role is in all of this, and that is that you follow our policy handbook, that you follow the agreement form that we have each family sign every single week, just saying that you would notify us if you are awaiting test results or if someone in your household is awaiting test results, and that you will keep your child home until those test results come back. The child can return once the doctor clears him or her. And because this parent in particular followed each of our guidelines and decided to get tested, even though their symptoms weren't very bad, they just started to feel a little bit unwell, they got tested out of precaution. And I do believe that that really helped us get through it without any other staff members or any other students coming down with any symptoms. So that was the one and only case we've had so far this summer, but it was a good learning experience for all of us, and really just helped us to see that a lot of the things that we're doing is helping, and then a lot of it really is up to the parents to do your part. So we're all here working together and trying to keep everybody safe here and creating an environment where the kids have a safe place to come and have fun and learn, and we just want to remain open so that we can continue to serve our communities. I will attach our actual COVID emergency response plan to the email that this video is attached to, just so you can read over it. A lot of it has to do with the screening of each student and staff member who comes into the building. We're following a very strict health policy, sick policy. Your child, if they do become ill, will not be able to return to school without a doctor's note. So a lot of the things that we're doing in precaution to this will help to eliminate the spread as much as possible. So the next item that I wanted to talk about, which was asked in our survey questions, had to do with how we were handling commingling. So in the fall, it is going to be a little bit trickier because we do have 7 classes, and for preschool, we have to consider how much staff we have available to prevent commingling and all of that sort of stuff. So the schedules is really a huge part of it. So in order to prevent the classes from ever commingling would be really, really, really tough. So the health department just recommends that we prevent commingling to the greatest extent possible. And what my goal is that we will have a sort of a buddy system, so that if we have to commingle during drop-off and late afternoon for pickup, that the classes will always combine down to the same 2 classes, which would make those 2 classes one group. And that way, if anything does happen, it will hopefully prevent any one child from getting all of the children sick in the school, but then it will help us narrow down our scope to that group of students, hopefully, so that we can, move forward in that scenario. So those are our goals, is that we would have a buddy class where we would have to determine that based on what siblings are in which class. It would be based on a lot of the enrollment for each class, so what space we have in each class, and then we would decide which class would have which buddy class for opening and closing at the ends and beginnings of each day. So hopefully that helped to answer a little bit of what your question is. We are going to prevent commingling as much as possible, meaning that the children will stay within their own group as much as possible. So our biggest challenge is just the opening classrooms and then the closing classrooms. And it would be really challenging for us to have enough staff to have 7 openers and 7 closers. So we will have more openers and closers so that we can have those same groups with the buddy system. But it would be really, really difficult for us to have completely no commingling amongst any of the classes ever. So that would be the best scenario that we could come up with in working with licensing in the health department, which a lot of their guidelines are just that. It's to help the school come up with the best, safest environment that they possibly can come up with. So that was one of the things that we're working towards. That is the goal for how we are going to handle the commingling in the upcoming school year. The next thing that I wanted to talk about was class sizes. So there is no set limit that the health department is giving us at this time. They can change that and require that we have a certain amount, but as of right now, they are saying that we need to enroll to the lowest possible number in order to keep a healthy and safe environment for the students. And for us, we have talked about a lot. With the older classes, we feel comfortable with a maximum of 12 students. And then with our younger classes, like the Penguins, who is more of a transitional class, they're still potty training, we were thinking of doing more of a 10 student maximum, and then potentially in the toddler program doing a 6 student maximum. So based on their ages, based on the children's needs, we're really looking at limiting the amount of students that we normally enroll, where we usually would have up to 15 students maximum in each class. But the older they get, the little bit easier it has been for us, that we found in the summer, in making sure that we can still implement all of the protocols and all of the policies and procedures that we're saying that we're implementing. So we're really trying to work through those different things. We are going to limit our class sizes, and once all of the final numbers are definitely set in place, and which this can change, as I said before, the health department can decide to come up with a new mandate that says we have to limit all classes to a certain number. And so that this definitely can change. But as of right now, they're saying as long as we can follow all of the guidelines and things like that, that we can choose the best number that we can do for our school. And one of the other things that I wanted to talk about was just just had to do with our sick policy, which I think is really important for everyone to be aware of, that every single morning the students and the staff are being screened. They will have their temperature taken and then asked, if they've had any signs of cough, fever, shortness of breath, or any exposure to someone who may have COVID. And you will also be asked to sign an agreement form each week that will require you to let us know if there is possible exposure. You're agreeing not to bring your child to school if you or anyone in your household feels ill without a doctor's note, and just making sure that we're all on the same page. All of the adults on campus, the teachers, the staff, and the parents are going to be required to wear masks. And this is just really important because we don't have any other defense against spreading COVID amongst adults. So the best thing that we can do is just wear a mask and hope that it helps. So we are requiring all adults on campus to wear masks, and that is also mandated by the state of California. So we're following all of the restrictions and guidelines that they're requiring us to do, and we're working together with other schools, other preschools in Riverside County, as well as other schools in our district through accreditation, and talking to other directors and trying to figure out what they're doing as well. So it is definitely an ongoing process as we continue to make these updates and these changes for the kiddos. And I know one of our number one goals is just to make sure that the kids are happy, that they feel welcomed and safe, and that they're having fun, and that life can sort of go on hopefully as normal as possible for them, as much as possible. And that is definitely the number one goal of our staff and of our teachers, and so that we can be open for our families who need to go to work and who just need to take care of other responsibilities, so that they're in a safe place while you are not able to be there with them. So we are definitely looking forward to the start of our next school year. We are going to be planning a back to school sort of day for families to schedule a 15-minute time slot to come in with your child, meet your teacher, and see the classroom. And that will be nice considering the parents will not be able to pick up or drop off inside of the building. So we are going to schedule a time slot at that last week in August for back to school, and then I will have a new video for parent orientation as well. And we did just get a new virtual tour up and running on our website, so if you check out the website at emmanuelriverside.com, you can see the virtual tour for both the preschool and the elementary school, which is really cool because it gives a really good realistic view of what our building looks like if you've never been inside of it. One of the other things that we've already decided to do was to end our snack program. So we decided to do that for many reasons. Other preschools in Riverside have already decided that they are going to end their snack program as well, and a lot of it has to do with the safety and handling of the food and cross-contamination, but it has to do with the budget as well, because we're limited to the amount of students we can enroll. Then we're working on a very different budget. So we need to sort of do some checks and balances when we're purchasing more of cleaning supplies and things like that. Then, we need to figure out how we're going to work all of that into our budget. So the snack program, basically the biggest change is just going to be that parents will have to provide a morning and afternoon snack for your child, and we will have milk and juice on hand to serve with your snack. But for the most part, all of the food that your child will be eating will be brought from home and chosen by the parents. Another thing that we are looking to do is just creating a class list of supplies for each individual student, because one of the number one things that we are implementing right now is that each student has their own Ziploc of their own supplies that they use throughout the day. That way they're not sharing markers and crayons and scissors and things like that would have to be sanitized between each use. So when the students have a project to do at the table, they just have their own supplies that they use, and it sort of eliminates that cross-contamination. So it's sometime in the short future, you will be receiving a list of supplies that you could purchase for your own child to have here at school, which would help us out a lot. And if you aren't able to do that, that's definitely understandable, and we will still supply the individual supplies for your student. But the more families who can help out in that way, then the better it will be for us. So we're just trying to come up with ways to keep the children safe, to make sure that we can still run the program and have the same curriculum and the same activities that we normally do, but just altering a few things to do it in a safer environment. And I will be sending out a comprehensive parent handbook, hopefully at the beginning of August, for everyone to sort of be able to read over and see exactly what each little section is going to be talking about, as far as how lunch is going to go, pick up and drop off, safety and cleaning, all of the different things that are normally in the parent handbook, and what the new policies and procedures will be for this upcoming school year. So it's definitely a new situation for all of us. And, we're all working together to move forward as best as we possibly can. So if you have any comments, questions, or even suggestions for me, just email me at trona.salgado@gmail.com, or you could call me at the office at 951-682-4211. I hope that you have a great rest of your day, and we can't wait to see you guys soon. Bye.